Most states across America have effectively shut down all non-essential businesses since mid-March, after signs of a pandemic threatened the nation.
We've never had a situation where the entire country has really, pretty much the entire country has actually shut down the economy in an effort to keep a virus from spreading.
We have been a pretty busy restaurant in this area, but when the lockdown first started on March 17th, we realized the first week was horrible.
The shutdown has left a detrimental impact on both small and large businesses alike. Jobless claims have soared to a record-breaking 38.6 million in just 9 weeks. And heavy declines in the market mirror concerns over the American economy's ability to recover from the pandemic.
Government ending a lockdown right now is like telling people at a beach they can go back in the water, but the shark's still out there. Some people will go in. The economy will partly reopen, but it's not going to be the same.
On May 14th, the CDC released its guidelines for safely reopening schools, businesses, and transit, as more states began easing restrictions on May 15th. Economic recovery relies heavily on how successfully the U.S. can reopen for business. So how exactly is the U.S. planning to open its economy? The American economy has faced a substantial loss due to a nationwide shutdown. On April 29th, the Bureau of Economic Analysis reported that the gross domestic product shrank by 4.8% in the first quarter, the lowest it's been since the worst of the 2008 financial crisis. It's partially due to a steep 7.5% drop in consumer spending, which makes up about 67% of total GDP.
So one way to think about GDP is that it measures the supply equals demand of the aggregate economy, where the supply is how much we all produce and the demand is how much we all buy. And so if consumer demand collapses, then that's going to feed back and mean that there's less produced.
The worst may be yet to come, as economists predict that another 20 to 45% contraction in GDP might be possible during the second quarter.
Restaurants are part of our economy. Theaters are part of our economy. The movie business is part of our economy. So if we want to recover all of those things, and I think ultimately we do, we will need to reopen.
As the S&P dropped as low as 2,191 points, 35% from its peak in February. President Trump attempted to mitigate the damage by expressing a potential deadline to reopen the economy.
I hope we can do this by Easter. I think that would be a great thing for our country, and we're all working very hard to make that a reality.
That was eventually shifted to May 1st after criticism from health experts.
The day will be very close because certain states, as you know, are in much different condition and in a much different place than other states. It's going to be very, very close, maybe even before the date of May 1st.
The president has really staked his reelection very much on the strength of the economy, and the economy is now not doing very well. It's actually doing terribly. If he's going to run for reelection on the claim that he's built the best economy ever, then he's going to need to have people at work.
Although the majority of the U.S. still remains under lockdown, states like Georgia began reopening parts of its economy on April 24th.
By taking this measured action, we will get Georgians back to work safely without undermining the progress that we all have made.
So, there really is a contrast among the states in what they want to do. And to some extent, to be fair, that's partly because the states really do look and feel very different from one another. I can think about my own state of New York, where Governor Cuomo has been quite measured about what he wants to do. But even so, he's saying there are parts of the state that can reopen pretty soon.
We have different states at very different places in the COVID outbreak and with different public health responses themselves. So the states have been scrambling and implementing different procedures and are at different places in combating it. And so it's crazy to think we can flip the national light switch back on, reopen the economy nationally, given that they're at all different places.
The U.S. will most likely reopen the economy through incremental easing.
The concern is that if we open everything up right away, people will be mixing a lot, and the virus will spread again. It hasn't stopped spreading by any means. So we haven't really dropped the number of people with the virus low enough that we feel like we can control it. So the thought here is, can we open those parts of the economy where there's relatively little interaction among people?
On April 16th, President Trump unveiled a 3-phase guideline that gave a first glimpse into how the U.S. might reopen for business. The first phase encourages employers to gradually bring back its employees. encourage telework when possible, close common areas, and minimize non-essential travel. Large venues like restaurants, movie theaters, sporting venues, and churches, as well as gyms, can open under strict physical distancing protocols. Schools and youth activities should remain closed, but elective surgeries may resume. Phase 2 still encourages telework, keeps common areas closed, but non-essential travel can resume. Schools and organized youth activities are permitted to reopen, and distancing protocols for large venues and gyms are reduced from strict to moderate. Bars are also permitted to open during this phase, but with diminished standing room occupancy. The final phase allows all employees to return to work, and most venues, including visits to senior care facilities and hospitals, can resume with diligent but limited physical distancing protocols. Large venues and bars should still also operate under limited physical distancing protocols.
Those guidelines were extremely broad. They didn't have enough specificity for anybody to act on them. I don't think I think the basic contours of it, everybody agrees that's what we kind of need. But what that means in a particular context, that's what the governors are working out right now.
In reality, states will individually choose how they plan to reopen, despite President Trump's claims that it is his decision when the U.S. economy will reopen.
That it isn't really the president's call to reopen the economy. He didn't close the economy, and it won't be up to him to reopen it. That's a decision that will be made in the various states and is already being made in the various states with different governors, some of them moving ahead more rapidly, some of them moving ahead more slowly with different plans, often according to the situation in their particular state.
State guidelines for reopening differ wildly, but a key difference lies in which sectors will open first and the speed of the process. Less impacted states like Iowa simultaneously opened restaurants, fitness centers, malls, and libraries at a 50% capacity on May 1st. More heavily impacted states like New York have reopened only some parts of its states after May 15th. There, the retail industry is expected to open first, followed by restaurants, hotels, and schools in the later phases.
Certain types of business put their customers at very high risk and are major threats. So think of like movie theaters, for example, or plays and large entertainment venues. Those may be businesses that probably should stay closed longer until we have the virus more contained and more PPE and the like. But there are other businesses that don't put their employees at high risk, and those maybe could be open now.
None of the states have had a 2-week decline in case numbers, as recommended by the federal guideline before reopening. The U.S. reported its deadliest day for coronavirus patients on May 1st. The same day, partial reopening went into effect in 14 states.
These are places that have relatively low caseloads and not a lot of mixing of people. So that's group one. I think the other group of states are places where ideologically they really just feel like they want to be open. Some people have suggested that part of it is to cut down the state's burden of unemployment insurance. So there are fiscal reasons for the state to reopen.
However, for small businesses, reopening the economy at the earliest time possible is vital in staying afloat.
When a small business or a restaurant goes into bankruptcy, it may be that there's not enough demand for that business to be profitable and it should close down. However, in the COVID-19 situation, in the current recession, it might be that a lot of small businesses go bankrupt that should continue to prosper, that would be viable businesses absent the disease.
Texas was the largest state in population to reopen its economy on May 1st. It allowed restaurants, retail stores, and movie theaters to open at a 25% capacity. It's the first phase of Governor Greg Abbott's plan in reopening the economy that permits certain services and activities to open with limited occupancy, while issuing minimum standard health protocols for all businesses and individuals to follow.
Right now, we have like a occupancy of 19.25 people. So we have like 5 tables. It's not even like a dining room from what it looks like, but we just play by the rules, but we have only 5 tables.
Even if businesses open, consumers may not feel confident to venture out. A recent study revealed that more than 2/3 of Americans surveyed will actively avoid public places after lockdown ends.
If you tell me, oh, you can open 100%, how many people will actually come out and eat? It's an unknown. I'm not sure. But so, do I want to be open? Yes. But do I really want to be open if people are not ready? not really.
And so the first order for the policy and for the economy is that we combat the disease effectively and bring its prevalence way down and provide people with safe working environments and safe consuming environments.
While state governments grapple with how to save their economies, healthcare experts contend it is unsafe to reopen.
We're not remotely prepared, neither in terms of the epidemiology of the outbreak in the United States, and nor in terms of our preparedness capacities to begin suppressing this virus in ways other than through social distancing.
If we open up and lick it in the state that I live in, and the neighboring state is just entering the phase and is open and is allowing the disease to run rampant, that's going to spill over. That's going to affect me like the person at work next to me having the flu. So it makes it very difficult to have these haphazard state-by-state reopenings.
Experts also fear the possibility of a second wave of infections that could shut down the economy once again.
Our guess right now is that seasonality will still occur. So we've got to be careful about what happens in the fall. We've got to be thoughtful as we start to try and reopen society and reopen the economy.
I hate to be grim. A second wave of infections would be, I think, an even more major economic disaster than the current one. And so if a second wave of infections hits, we will be coming out of a bad GDP shutdown with a high unemployment rate and a debt to GDP ratio greater than 100%. And projected deficits for this year are already $45,000 per American household. And so it's not obvious that we can afford another CARES Act, that we can do the things that we would like to stabilize the economy, and that we would be going into it in a much worse economic shape than we went into the first wave.
The success of economic recovery will likely depend on how fast states can reopen while maintaining safety. However, there's one thing that could better ensure a successful reopening.
I think it is not surprising that we don't have consensus on what the right thing to do is. I do think that the one piece of this that you would find agreement among pretty much all the experts is around testing. If you want to reopen, you want to be able to be testing people rapidly, because if this starts to spread, the key is to catch it really quickly.